Do you have any meniscus pain or meniscus tears or dealing with any knee pain? In this video, I'm going to explain what exactly the meniscus is, what causes this, and what you can do to actually solve this issue. What is going on, guys? My name is Dr. Nick Buonforte, and in this video, we're talking all about the meniscus. Now, I drew a little depiction of the knee right here. I'm no artist, as you could tell, but hopefully we can get a good grasp and an understanding through this. Now, before we get into the details on how to treat this thing and how to correct the problem, we have to take a step back and understand what we're actually talking about. So this is the femur bone or your thigh bone, and here's the patella, and then here's your bottom bone or your tibia bone. Now, the blue in this case is the ligaments and the meniscus. So you have two ligaments on the side of the knee, which is the medial and the lateral collateral ligament. You have the meniscus here, and then this little X is the ACL and the PCL. Then these all are acting as stabilizing structures, but in this video, we're just gonna be focusing on the meniscus. This little picture right here is as if I'm looking at the top part of the tibia bone. So I'm looking down on the tibia bone. So the meniscus is this crescent-shaped like structure. Now, the function of the meniscus is twofold. One, for stability of the knee, and two, it acts as a shock absorber. So when you're taking a step, or you're lunging, or you're coming off from a box jump, your meniscus is a shock absorber to all of these things. It also adds for stability given the dimension of it. So that's the main functions of the meniscus. Now, when we have a meniscus tear, there could be a variety of tears. There could be a tear going straight down on the meniscus, across, or we could have a tear that actually flaps off and goes into the joint. All these different types of tears will be dependent on the severity of the injury, the mechanism of the injury, but it really just depends and is really individualistic. Now, when you are dealing with a meniscus tear, you also have to think about the layering of the meniscus. The meniscus has different zones, and depending on the zone of the tear, that will dictate some of the healing processes. As we get deeper and deeper and deeper into the meniscus, there's less blood flow and less likely that the meniscus can heal just naturally given the type of tear. But the further out you get towards the knee, the outer edges or the outer zones has a little bit of a blood supply that can actually help this type of healing process if you have a tear. So that's just some insight on the healing processes. The further, deeper zones you get into on the meniscus, it's avascular, no blood supply. The further out, the outer edges, you're dealing with a little bit of small capillaries and blood vessels, which can give some healing to the meniscus. Meniscus tears are actually super common. They happen in a variety of sports and just general activity. A lot of times, the meniscus is torn when you compress and rotate. So when you're doing this from a high velocity sport such as basketball or football and you're cutting, that can lead to a meniscus tear. And then these things create a lack of inherent stability. As I explained about before, the meniscus has two functions, stability and a shock absorber. So when we have a tear or an injury to this meniscus, we lack the inherent stability of the knee. That's why it's common that when you have a meniscus tear, you hear of lack of stability, or my knee is giving out, or I feel like it's buckling, or I feel like my knee is stuck on something. In that case, that's typically when we're dealing with a flap injury and there's a little flap of the meniscus in the joint space and you're actually hitting that. That's when it could be like feeling like a locked up. So variety of symptoms depending on the type of meniscus tear you potentially might be dealing with. Okay, so now that we have a better understanding of what this meniscus is, the job of the meniscus, common types of injuries and tears, let's dive a little bit into some exercises to go about treating this. All right, so one of the first exercises we're going to be working on is actual building the rotational capacity of the knee. As I explained before, the meniscus is commonly torn with compression and rotation because the knee typically lacks rotation. The knee doesn't just extend, straighten, and bend or flex. It actually does a lot of rotation. So as we go to straighten our leg, we actually what's called a screw home mechanism. There's to lock out the knee straight, it actually goes into a little bit of rotation. And to actually bend the knee, it has to unlock, so it actually goes into a little rotation. So in order to build the capacity for rotation, we got to work on it. So here's the first one. We're going to be grabbing underneath the knee or holding up our knee. We're going to bring the foot all the way up to lock out the knee, or lock out and isolate what we're going to be working on. From here, I'm going to be rotating my whole leg in as my ankle goes in, and then my whole leg out. And you're going to be just going in and out. But you have to be mindful of the ankle, not just going flip-flopping back and forth of in and out. You have to really work on the rotation of the knee. So if you put your hand on the front part of the knee and you do this, you should feel a bone moving underneath your hand. That's the tibia bone actually moving into rotation. This is also good to not only build rotation into the knee, but it helps give some fluid and dynamic movement into the joint capsule of the knee. So we're here, we go in and out, in and out, and again, we're just isolating rotation happening at the knee. This should not obviously be painful. It should be nice and easy, going in and out, really working on the rotation of the knee. All right, the next one up for the meniscus is to decompress the meniscus. So we're doing a traction exercise with an ankle weight. We aren't doing the kicks, we're doing a traction exercise. So this one, the ankle weight is on the leg, the lower leg. The weight is going to be dependent on really how you're feeling with this. I like to typically go 5 to 10 pounds, or enough where you feel like the leg is being tractioned down. So why is this important? Because if we back up and remember, the meniscus is exposed to a lot of compressive forces. So when there's a tear, there's pain going on, decompressing the area or taking off the compression from the meniscus can give some relief to it. By tractioning it, it plays into the joint capsule, it lengthens it, and it also helps diffusion or synovial fluid to go in and out to basically help heal the meniscus. So with this one, the ankle weight is just on the bottom of the foot, and all you're doing is literally just hanging out and dangling your leg back and forth, letting you feel the weight pulling the leg down. On top of that, also gravity's pulling it down. So I'm literally just hanging out here and I'm dangling my knee. I'm not straightening it and swinging back and forth like this, because that defeats the whole purpose. I'm literally just going nice and easy, and I typically hang out here for about 5 to 10 minutes. And I would probably repeat it multiple times per day. But the idea is that you're getting a lot of traction through this knee, decompresses the meniscus, offloads the meniscus, and helps some fluid get in and out of the joint.